raise allocation for health, safety net, says Sanim, urging government to allocate more for education as well. The health, education, safety net, and agriculture sectors should be on top of the priority list in the next national budget to protect the people and revive the economy from the prolonged coronavirus pandemic, said the South Asian Network for Economic Modeling (SANIM) yesterday. The 0.92% allocation for the health sector is too low in terms of GDP, and the extreme vulnerability of the sector has been exposed during the pandemic, the think tank said. For all latest news, follow the Daily Star's Google News channel. The South Asian average expenditure in the health sector is 3.48% of the gross domestic product (GDP). The dismal picture of the health sector becomes clearer when expenditure is considered. Only 28.7% of the allocation was spent between July and April, the first 10 months of the outgoing budget, way below 72.3% year-on-year. The expenditure trend indicates the Health Ministry needs to improve the quality spending capacity of the allocated resources, the SANIM said. It also described the allocation for the education sector, which is 2% of the GDP, as meager. Many poor students, especially in rural areas, could not attend online classes as they do not own laptops or smartphones. The upcoming budget needs to allocate a significant amount of money to the social safety net as many people lost their jobs and nearly 3 crore people became new poor due to the COVID-19 fallout, said Saima Haq Bidisha, research director of SANIM. In her keynote presentation during the pre-budget webinar styled Budget 2021-22, Reality and Expectations, Professor Bidisha said 42% of the people were living below the poverty line, which is double the 21.6% in pre-pandemic times. She said the government would need to transfer Tk 5,132.65 crore per month to pull the poor above the poverty line. But there is no significant program for the new poor in the budget for fiscal 2020-21, Bidisha, a professor of the Department of Economics at the University of Dhaka, said the per capita allocation of Tk 500 as an old age allowance was too insignificant. The proposed benefit of Tk 3,000 per month to the elderly aged 90 and above is yet to be implemented. More than 70% of the elderly do not receive any kind of financial support. The monthly Tk 500 allowance for widows and destitute women, the Tk 100 stipend for primary school students, and Tk 1,500 support for the financially insolvent disabled people are also low, according to SANIM. Professor Bidisha called for expanding the social safety net to the urban poor as many people living in the cities slipped below the poverty line due to the ongoing crisis. Many have lost their jobs and small businesses that they depended on to run their families. So, the government should not only increase the allocation for the social safety net. The allocation should be spent in a way that generates jobs for those who lost ones for smooth recovery of the economy. More than 68% of the wage employed in the agriculture sector saw a reduction in their income, and around 73% of self-employed observed a fall in production, sales, or profit, Bidisha said. Spending in the agriculture sector was 0.45% of the GDP, on average, for the last 5 fiscal years. 38% of the wage employed and 31% self-employed in the sector experienced a contraction in income and have not recovered. Professor Bidisha suggested the government implement the stimulus packages for the large, cottage, micro, small and medium enterprises to help them turn around. Salim Rahan, executive director of SANIM, said the government needs to act in such a way that the economy recovers from the severe fallouts of COVID-19. Many European countries are recovering from the impacts of COVID-19 with the assistance of government-sponsored stimulus money. Professor Rihanna opposed the whitening of black money facility in the next budget and suggested massive reforms to curb corruption in the financial sector and misuse of budgetary funds during the implementation stage.